quick update on everything in advance of the day. The first thing is PPE, massive issue for us. Not so much the access to it, we have got it, although the other day, and this just gives you a little idea on this, one of the CCGs came into one of our homes and they said, we don't agree with the fact that you're using these reusable masks. We said, why not? They couldn't tell us why not. So we basically challenged that, obviously, because they're perfectly right for reusage. And they said, but don't worry, because we'll give you 300 masks. And we said, well, that's great, but what are you going to do for the other 700 that we will need? Because we get through 1,000 masks on that one site a week. So anyway, that is a big issue. And the other thing that's a big issue is Public Health England, with this insistence that everybody should wear a mask at all times. The statistics do not bear this out. We did a survey, over 701 services, not just ours, 11 of those were ours, but the others were other operators across the country. It covered over 5,200 individuals being supported, service users, and the infection rate was less than 30 individuals, and that's across the country. That's based on a sample of 5,200, which is a percentage, I think it was about 0.44%. Sadly, there were some deaths, and the deaths were less than 10 individuals, which is very sad. But anyway, they as a percentage were 0.17%. And so what it does say is that actually we and others in the sector around learning disabilities have been incredibly effective with the way because this was all prior to the announcement of this change in PPE, and prior to that date we've been incredibly effective in our ability to be able to manage the risk on our sites for your sons and daughters, my daughter, and so on, and staff. So this is an overkill situation, and sadly this is the way things happen when government and people get into a problem situation. They then act first and then have to think second. So it's a big issue. And the issue really is that we have individuals in our service who cannot tolerate staff being in masks, so they're trying to rip the masks off people's faces. We have other individuals who cannot lip read. They cannot lip read because the staff member has a mask over their mouth. And we have other individuals who are reading the expression on staff's face, and they can't read that anymore. And then we have other individuals who are used to eating with the staff. Staff can't eat with them because they're wearing a mask. All of this leads to, depending on the individuals being supported, it leads to massive issues. Not for some, but very big for others. And we're saying is that this is a bigger risk, and that they should go back to what they were doing pre-April the 27th, where they gave us the ability to risk assess. Anyway, we've taken legal advice on this because it's about being able to establish the levels of risk, and there are massive implications after all this sort of winds down in the future, over claims and so on. So we've had to spend a lot of money on legal fees, which I was a little bit shocked when I got the bill today, but that's what we've had to do because it's the right thing to do and to understand it. We've tried to alert the whole sector. A lot of people within the sector are breaking the rules. They're doing what they're doing, and I think they're causing a potentially very big problem for themselves. So this is a case of very poor lawmaking legislation. Effectively, the guidance effectively becomes the law because it relates to the legal stuff around PPE. Okay, move on. Testing. Well, they made their target, the government, which was great, 120,000. I think we've really paid the price ever since. Because we had one individual, we've now been waiting 6 days for the results to come back. So, I guess this is inevitable that when you're ramping it up, that there will be other problems within the supply chain. But, this is a problem at the moment. Individual, 6 days now, we've had this uncertainty and they still haven't got the feedback from it. So the quality of the testing has been hit in the short term, but being the optimist, hopefully they'll sort it out. Food's well under control, and again, I really want to thank the parents who've been helping to distribute that. That really very, very kind. Staffing level is really good. Staff are being fantastic. Aren't we lucky? Really, really lucky. So that's great. What we've had today is we've had quite a lot. We've reviewed the new norm. We've made some decisions. We had a long meeting yesterday about it, and what we've decided is that this is the new norm. You know, we were all geared up to be hit really hard. It's not happened in the way we thought. So this is about, this is now about the marathon. This is about the long run. So we are making a lot of changes operationally. How that will affect you guys is that we will be standing down the weekend COBRA meetings, micro COBRA meetings. So we're only going to have them 5 days a week, unless there is an issue. And if there is an issue, then we will pull them forward and we will reinstate them as and when they're needed. We're not going to have a COBRA meeting tomorrow because it's Friday, so there'll be 3 days without any of these COBRA meetings, but rest absolutely assured that if there's any issues, they will be dealt with straight away in the normal way. That also means that our one team workings will only go out now after a micro COBRA meeting. There's a lot of things that we're reinstating. We're reinstating all of our one-to-ones. We're now going to be having staff meetings every 2 weeks. We're putting a lot more content back into all of those. We've got our service delivery meetings happening, our people meetings, our rota meetings. These are all now going to a whole nother level. And what we're really doing is we're re-looking at all of our comms capabilities within the homes, so that we can actually have in any part of the home, we can actually have two comms meetings at the same time, so that everything's being done obviously on Teams, so we can break people up and into different groups and so on. So we're going to invest in some more TVs, better infrastructure there. That's all underway. We're going to be really looking at activities that are happening within the homes, because obviously we want these to be meaningful, because people are not going out. So there's a lot of stuff going on there to get us back to our new norm, which will look very much, it will provide us with the data and the way of operating that we had pre the COVID-19 problem issue, but it will be done in a different way, because it will have to take social distancing into account, and it will be very heavily reliant on Teams. Thank God for Teams and Zoom. Otherwise, I don't know how the country would have held together. It's been absolutely phenomenal. So now, one of the things is that we're due to do a parent-carer update, and I discussed that with Jane in our communications team. And what we're very conscious is that a lot of you guys are asking about what are we going to do post-lockdown, and as lockdown starts to ease up, in terms of sort of having access to your sons and daughters. So what we're doing at the moment is through Claire Stevens, who talks to a lot of you, and generally through the comms teams, to pick up a lot of questions that you guys have been asking. Different people have been asking different questions. So what we're going to do is we're going to do a Q&A session within that. So we'll find all of your questions, and then we'll work out answers, which I'm sure will be satisfactory to you. I mean, one of the issues about sort of seeing your sons and daughters, we're going to have to do that on a slightly progressive basis, obviously. But what the issue will be is finding neutral areas where we can sort of meet away from the homes, and we've got to look at all the risks and so on that are in there. But rest assured, we will be doing that in an intelligent way, which will satisfy your requirements, as long as they are obviously reasonable and proportionate to the environment and circumstances in which we're operating, which I'm sure they will be. So I think that's about everything from me. Have a lovely VE Day celebrations tomorrow, and have a great weekend. And let's hope that things are again in a relatively sort of optimistic sort of state when we get together next week. All the best. Thank you. Bye bye.